The health of the older adult population is very much a reflection of our overall health as a nation.
People are living longer. People at 50, 50 years ago were considered to be probably getting towards the end of life. 50 now is considered young. And at age 50 and up, your nutritional needs do change.
Aging isn't preventable, but older adults could live healthier lives if, in fact, they were receiving the adequate nutrition they need.
There are many factors that might prevent older adults from getting the kinds of foods that they need to support their health. These could include physical limitations, economic barriers. Cultural issues might also limit one's ability to get nutritionally adequate foods.
Older adults are taking care of their kids and their kids' kids, and so often this is a group that will say, I'll eat last, let my family eat first.
It takes a lot of resources to meet the nutrition needs of older adults. It means an integrated approach to reach older adults just about everywhere.
It's a complicated issue, but it's central if we want to talk about the aging of this country and having that be a positive and healthy experience.
Ultimately, what we're trying to do is to prevent people from developing a disease or to delay that as much as possible. We have to be part of the dialogue with the policymakers, the media, and we have to make sure that nutrition is something that people are aware of.
All right, good morning. I see our audience has dwindled a little bit, but I'm glad there's some hardcore folks still here. We have another ambitious program planned for the morning. And the first session is going to be the role of community in the food sector, moderated by Susan Crockett. Our first speaker wasn't able to make it. I would claim, as I did yesterday, that we planned it that way so we'd have more time, but we didn't plan it that way. But it does give us a little bit of cushion. That said, I'll reiterate that we would really appreciate if the speakers tried to stick to their allotted times, because it's just not fair to the other folks. And then after that, we have a break and a panel, and then a final session moderated by Nancy Wellman on research priorities and gaps. The only other announcement I have, the small working group that's going to get together with us after the workshop on BMI and outcomes, a future workshop that we're going to hopefully convene, is going to meet in room 227 after the workshop is over. But thank you for coming, and we'll jump right into it.